This video is intended to educate the general population about hearing impairments in older adults. Hearing impairment is defined as the effect of a disability on a person's capacity to meet personal, social, and occupational demands. Hearing loss is the third most prevalent chronic condition in older Americans. It is the fourth most communicative disorder of older adults. The prevalence of hearing loss is 90% in those older than 80 years, 40 to 45% for those that are 65 years old and over, and 83% for the ones that are over 70 years. A good understanding of the basic anatomy and physiology of the ear is really important to be able to assess, diagnose, and offer appropriate treatment options for someone with hearing loss. The ear can be divided into three sections. We have the external, the middle, and the inner ear. The external and middle ear are mainly involved with sound transmission, while the organ of hearing, the cochlea, as well as structures concerned with balance, are housed in the inner ear. The external ear consists of the pinna and the external auditory canal. The inner ear houses the cochlea, which is shaped like a snail shell and is the organ of hearing. We have two types of hearing loss. The sensorineural hearing loss results from damage to any part of the inner ear and the neural pathways to the brain. Example, presbycusis. And the conductive hearing loss, which usually involves abnormalities of the external and middle ear that reduce the ability of sound to be transmitted to the middle ear. Cases like otosclerosis, infection, perforated eardrum, fluid in the middle ear, or Sherman, which is wax accumulation, can all cause conductive hearing loss. What is the importance of this topic? Hearing loss reduces the quality of life in the elderly and is associated with multiple negative outcomes like decreased function, miscommunication, patients cannot communicate with providers or caregivers, depression, loss of self-esteem, falls, cognitive declines, and safety risks. Hearing impairment increases feelings of isolation and may cause older adults to become suspicious or distrustful or to display feelings of paranoia. Hearing impairment is also underdiagnosed and undertreated in older people. Because older persons with a hearing loss may not understand or respond appropriately to conversation, they may be inappropriately diagnosed with dementia, which is a problem of memory loss. What are the causes of hearing impairment? It can be frankly genetic. It can also be secondary to illnesses like atherosclerosis, infection, or frankly secondary to surgical interventions. Some medications can cause hearing impairment, like some antibiotics, obstruction in cases of wax impaction in the ear canal, or trauma. How can we manage hearing impairment? We have some devices that are available in order to help the older adults dealing with hearing impairment to improve hearing, like hearing aids that's going to improve sounds or hearing. We have also assistive or adaptive devices, for example, telephone amplifying devices, TV and radio listening systems, assistive listening devices and alerts, or cochlear implants as a more advanced measure. It is very important to educate our population. The first thing that we need to insist in is ear hygiene. It is not recommended to use cotton buds or instruments because the ear is self-cleaning and fiddling with the ears adversely affects this process. If we have itchy ears, you should keep your ear dry from any entry of water by using cotton wool and petroleum gel. Also, we should reinforce smoking cessation. Check with your provider. They can give you program to help you stop smoking because there is some relation between smoking and hearing loss. We should also have some behavior that prevent ear infections. You should also have a really good balanced nutrition. Address any nutritional deficiency with your provider. And also, you should get appropriate immunizations or regular shots from the doctors. Based on the previous information provided to you, it is recommended that you perform good ear hygiene, you have a really good balanced nutrition. Check regularly your ear with your provider. And also, you should make sure that you are up to date with your vaccinations.